Hello, my name is Douglas Bloch. Welcome to the Depression Recovery Channel, where each week we talk about practical tools and coping strategies for healing from depression and anxiety. Today is Flashback Friday, a feature in which I republish one of my earlier videos you might not have seen that contains really important coping strategies that will help you attain a better mood. Now here's today's video. Before we begin our video, we have to tell our little pun of the day. What should an attorney wear to court? A lawsuit. Very clever, don't you think? Well, in a recent video that some of you might have seen, I described a disorder called complex PTSD, or C-PTSD. In complex PTSD, also known as developmental trauma, a person is exposed to long-lasting trauma or abuse that occurs over weeks, months, even years, with little chance of escape. Complex PTSD is often treatment resistant when people or psychologists use conventional methods of talk therapy. Therapists know very well that when a person experienced abuse, neglect in their childhood, they often spend years in therapy talking or emoting about their past trauma, and yet they have great difficulty moving beyond the trauma. This is because when a person's brain is still developing and they experience the abuse or trauma, they become hardwired to interpret events in a negative way. In this video, I will discuss or talk about or share trauma-based treatments that go beyond talk therapy to help people heal from developmental trauma. Now, these therapies are quite complex, no pun intended, and so I can only give snapshots of them because of the time allotted. However, I will be posting links after each therapy that you can click on, and you can learn about these therapies in much greater detail. The first therapy I want to talk about is something that's become really widespread, although it wasn't at the beginning. It's called dialectical behavioral therapy, or DBT, which is an evidence-based therapy that was originally developed by Dr. Marsha Linehan at the University of Washington to treat a really serious disorder that up to that time people didn't know what to deal with, how to deal with it. It's called borderline personality disorder. Now, according to Linehan, people with BPD grew up in invalidating environments, that's what she calls them, where the child's emotions, needs were not tolerated by the parents. As a result, the child never learned how to regulate his or her own emotions, nor solve the problems that were causing the difficult emotions, difficult pain. DBT is taught in a classroom setting, and it's combined with one-on-one therapy, and it consists of 4 modules. They are mindfulness, distress tolerance, emotional regulation, and interpersonal effectiveness. I find it interesting that although DBT was developed only to treat people with borderline personality disorder, it was so successful that it's been expanded to other populations that are having a lot of difficulty with trauma, such as drug addicts, alcoholics, people with PTSD, which is why we're talking about it here, and even quote-unquote normal people or non-neurotic people who want to just lead better lives and become more emotionally healthy. Now, if you'd like to learn more about this wonderful therapy, you can just Google dialectical behavioral therapy or go to the link below. The next therapy I want to talk about is called eye movement desensitization and reprocessing, or EMDR. EMDR was developed by a clinical psychologist named Francine Shapiro to help people or clients to recover from past trauma. Now, EMDR does not rely on talk therapy or medications. Instead, it uses a person's own rapid rhythmic eye movements. And these rapid eye movements are thought to dampen the emotionally charged memories from the past and therefore reduce the memory's emotional impact in the present. I've personally experienced EMDR, and what happens during the session is that the therapist will wave a wand or a finger in front of your eyes back and forth, asking you to follow them. And during that time, he'll ask you to recall a disturbing event, including the powerful emotions associated with the event. Then, after you've done that, the therapist will simply ask you to recall something really positive. And again, this is thought to dampen the power of the past memories and, in a sense, allow you to let go of them. If you would like to learn more about EMDR, simply go to the link on your screen. The third therapy I want to talk about is called internal family systems, which was developed by Richard Schwartz of Harvard University. In IFS, the mind is thought to consist of multiple subpersonalities or parts that exist within the person's mental system. The grounding assumption of IFS is that there are no bad parts, only parts forcing the bad roles. When a client learns how to access self, then they can heal their wounded parts. This brings the whole system into harmony and allows the person to be more led by self, which is really their central essence. The natural effect of this process is the healing of the core wounds that arose from the past trauma. If you'd like to learn more about IFS, simply go to the link on the screen. The fourth and final therapy I'm going to talk about is called lifespan integration therapy, sometimes known as life integration. This is a very recent therapy that was developed in the first part of the 21st century, which means in the last 20 years. Now, in LI, the therapist helps the person to connect with unpleasant memories and dysfunctional patterns and go back to the past experiences where these unpleasant memories and dysfunctional patterns originated. In other words, the past trauma. And the technique that they use is a repetition of what they call a timeline of memories and images. The client reimagines the past experiences, bringing into the present moment whatever is needed to resolve the memory. Repeated repetitions of this life review both integrate past experience and proves to the client's body-mind system that time has passed and life is different now. This proof occurs at a deeper level than happens with cognitive behavioral therapy and other talk therapies. If you want to learn more about lifespan integration therapy, go to the link below. This has been Douglas Bloch. I hope you found the information on this Flashback Friday video helpful. If so, please give it a like, as likes draw more and more people to this channel and hopefully some more subscribers. You can also leave your comments in the comments section or email me douglasbloch@gmail.com. If you do want to subscribe to this channel, click on my photo in the closing credits. You'll be taken to my subscribe page. And if you click on the bell to the right, you'll be notified every time I do a new video or live chat. And if you want to contribute to this channel and become a patron, simply click on the Patreon image. You'll be taken to my crowdfunding site. And until next video, I wish you the best in your mental health recovery. Thank you so much.